Hello, everyone. My name is Toni Lee, and I'm going to be doing an article review on the non-operative treatment of UCL sprains in the elbow. The title of my article was Non-Operative Treatment of Elbow Ulnar Collateral Ligament Injuries with and Without Platelet-Rich Plasma in Professional Baseball Players. The authors are listed to the left of the screen with their associated institution, as well as the citation to the right of the screen. The introduction of my article consisted of stating that current non-operative treatment of UCL injuries consists of rests, NSAIDs, and rehab exercises, as well as there being varying return to play rates in patients who received a non-operative treatment option to rehabilitate their UCL injury. There has also been a recent trend of using PRP injections in order to enhance the non-operative treatment of this injury, and the theory is that it'll promote the healing of the damaged UCL. The clinical rationale behind this study is that there are currently no larger comparative studies on the non-operative treatment of the UCL with or without PRP injections, specifically in professional baseball players. So the purpose of this study was to evaluate the effect of PRP within the non-operative treatment of UCL tears in the population study of pro baseball players on the parameters of return to throw, return to play, re-injury failure rate leading to a UCL reconstruction, and survival of the native tissue after the non-operative treatment had failed. The second purpose of this study was to try and determine an association between injury grade and location found on an MRI and its association with non-operative treatment outcomes and whether it was a success or a failure. The methods of this study included using the MLB Health and Injury Tracking System. It was a retrospective study where they identified 544 professional baseball athletes who had a UCL injury and were previously underwent non-operative treatment for that injury. And they divided them into individuals who received PRP injections in their treatment and those who did not. Since there was a wide variety of age, position, throwing arm, and league status, they matched one person from a PRP group and one person from a non-PRP group based on these demographics to each other to decrease selection bias. They also conducted an examination of the MRI using an experienced radiologist in order to determine the grade of the UCL tear as well as the location of the tear. From these methods, the results indicated that specifically with return to play and return to throw, the results were significant, whereas in terms of re-injury leading to a UCL reconstruction, survival of native tissue, and MRI grade and location, there were insignificant results. Within return to throw, it was found that the individuals receiving a PRP injection in their non-operative treatment had a significantly longer delay in their return to throwing program, whereas those who did not receive a PRP injection return to throw significantly faster. And this was regardless of league status, whether they were in the minor league system or the major league system. In terms of return to play, overall, there was a 54% return to play rate. But in the PRP group, there was a slightly lower return to play rate and had a longer delay in returning. The minor league players also showed that they had a significantly faster return to play when compared to their major league counterparts. Now, moving on to the insignificant results that I still think are good to bring up and mention. In terms of the re-injury rates leading to a UCL reconstruction, the PRP group did see a greater percentage of a failure of non-operative treatment than the non-PRP group, but again, these results were insignificant. There was no significant difference between the groups in terms of the survival of the native tissue that they examined once they underwent a reconstruction. And then in terms of MRI grade and location, it was found that the higher grades, so a grade 3 tear and tears that were more distal in the UCL, had a greater UCL reconstruction rate as well as a lower return to throw rate. Now, this slide is just to show how they identified the location of the sprain as well as the grade of the sprain. So the top MRI shows how they differentiated between a proximal, distal, or a both-sided UCL tear. And the bottom one shows grades 1, 2, and 3 of the UCL tear. The image on the right shows the breakdown of the percentage of players who received a PRP and those who did not receive a PRP, and under these categories, which ones had a grade 1, 2, or 3 UCL sprain. Now, the take-home messages from these results show that Over half the participants responded to non-operative treatment of a UCL injury and successfully returned to play. But it's important to note that the PRP injection group resulted in a significantly longer return to throw timeline compared to those who were just managed conservatively without getting an injection. It's also noted that lower level players returned to play a lot faster with conservative treatment, but yet there was no correlation between PRP and re-injury as well as survival of native tissue. Now, how does this relate clinically? PRP injections may not speed up the return to play process or return to throw process with respect to UCL sprains or UCL tears. And that as clinicians, we need to take into consideration the timeline needed to fully recover from a PRP injection, and that this will already inherently add to the time that it takes to go back into return to throw or back into return to play. So is that added time worth adding on to the return to play or return to throw process when it's already going to be significantly longer? Also, clinically, it's important to try that conservative treatment without the introduction of injections first to see if that is successful. Because if it's not successful, that may indicate a need of a further examination into a possible UCL reconstruction anyway. Also, remember that all of our patients will have different responses to non-operative treatment, and that not to take this study and run with it as saying that PRP injections may not work for some people, but they may work for others. This is my article that I used again, and thanks.